And this is actually how a cancer goes from being harmless to deadly. Cancer cells mutate, and they gain the ability to release lots of those angiogenic factors, natural fertilizer, that tip the balance in favor of blood vessels invading the cancer. And once those vessels invade the cancer, it can expand, it can invade local tissues, and the same vessels that are feeding tumors allow cancer cells to exit into the circulation as metastases. And unfortunately, this late stage of cancer is the one at which it's most likely to be diagnosed. Here's a woman with a breast cancer being treated with the anti-angiogenic drug called Avastin, which is FDA approved. And you can see that the halo of blood flow disappears after treatment. So I started asking myself, why haven't we been able to do better? And the answer to me is obvious. We're treating cancer too late in the game, when it's already established and oftentimes it's already spread or metastasized. And as a doctor, I know that once a disease progresses to an advanced stage, achieving a cure can be difficult, if not impossible. So I went back to the biology of angiogenesis and started thinking, could the answer to cancer be preventing angiogenesis? Beating cancer at its own game, so that cancers could never become dangerous. This could help healthy people, as well as people who have already beaten cancer once or twice and want to find a way to keep it from coming back. Can we eat to starve cancer? Well, the answer is yes, and I'm going to show you how. And our search for this has taken us to the market, the farm, and to the spice cabinet, because what we've discovered is that Mother Nature has laced a large number of foods and beverages and herbs with naturally occurring inhibitors of angiogenesis. So here's a test system we developed. At the center is a ring from which hundreds of blood vessels are growing out in a starburst fashion. And we can use this system to test dietary factors at concentrations that are attainable by eating. So let me show you what happens when we put in an extract from red grapes. The active ingredient is resveratrol. It's also found in red wine. This inhibits abnormal angiogenesis by 60%. So there's just one more disease that I have to tell you about, and that's obesity. Because it turns out that adipose tissue, fat, is highly angiogenesis dependent. And like a tumor, fat grows when blood vessels grow. So the question is, can we shrink fat by cutting off its blood supply? So the top curve shows the body weight of a genetically obese mouse that eats nonstop until it turns fat like this furry tennis ball. And the bottom curve is the weight of a normal mouse. If you take the obese mouse and give it an angiogenesis inhibitor, it loses weight. Stop the treatment, gains the weight back. Restart the treatment, loses the weight again. Stop the treatment, gains the weight back. And in fact, you can cycle the weight up and down simply by inhibiting angiogenesis. So this approach that we're taking for cancer prevention may also have an application for obesity. The really, truly interesting thing about this is that we can't take these obese mice and make them lose more weight than what the normal mouse's weight is supposed to be. In other words, we can't create supermodel mice. And this speaks to the role of angiogenesis in regulating healthy set points.